on the fact that lately we've been hearing a lot from the President about income inequality. And I anticipate we'll be hearing a lot more as we move toward the 2014 elections in November. There will be a debate on this, and I hope there will be a debate that allows both sides to look at this in a serious way and try to find ways to address the issue. But if we do that, I think it's important that we understand that the President's signature accomplishment, the Affordable Care Act, Obamacare as it is called, is contributing to the problem of income inequality. So any debate on that issue, which, as I said, we'll likely hear much more of as we approach the November election, any debate on that, to be factually accurate and to be truthful, needs to incorporate a conversation about the impact of Obamacare. As recently as 2012, we were told by the President that the health insurance premiums paid by small businesses and individuals, quote, will go down. And yet, even as the administration recently has admitted that many Americans will pay more for health care because of the Obama law, this week, in the latest report on health spending trends from CMS, the Centers for Medicare and Medicaid, disclosed that health care spending in the United States rose 3.7% in 2012. That is less than what it arose in previous years, and that's a good sign. Now, too many are saying, well, the reason for this is the Affordable Care Act. Had we not passed the Affordable Care Act, this wouldn't have happened. Apparently, though, they didn't read the rest of the report, because the report also states that the provisions in the Affordable Care Act had minimal impact on total national health spending. So while the administration may claim that their bill, the Obamacare, is lowering overall health spending, the report says it has only had a minimal impact. What's happening is that there are reforms being made through the private sector, through the providers, in terms of more efficient, more effective ways to deliver health care. That's not operating because of the Health Care Act, and in fact, Health Care Act, if we're truthful about it, is contributing to the problem of inequality. Many Americans are experiencing, despite what the President has said, higher premiums or paying outrageous deductibles when they purchase coverage through the Obamacare exchanges. Now let's bring this down to a personal level, because I've been receiving hundreds, actually thousands, of emails, phone calls, letters, comments that I hear back home from Hoosiers who basically said, this ain't working, and it's sure not working for me. But I want to bring it down to the personal level so we can understand what individuals and families are going through at this particular time with this mandate imposed upon them relative to their health care coverage. Thomas from Indianapolis wrote to me and said that he went on the Obamacare exchange to take a look at health insurance plans that would be available to him. And he was, as he said, and I quote, shocked to find that it was at least $200 a month, that's $2,400 a year, more than he had been quoted just a few months before from a broker. So he went to an insurance broker who said, well, under the Affordable Care Act, you will pay this. And then a couple of months later, because he was deciding whether or not he could afford that, he went back on the exchange and said, this is going to cost you $2,400 more than just it would have a couple of months ago. He added, and I quote, I have thought about just going without insurance, as we know many individuals are thinking about and have decided not to sign up for this program. And of course, the program is built financially on the fact that millions will sign up, and that's not happening, and I predict that's going to break the program, break the back of the program. And it's not just my prediction, it's those analysts and insurance companies and others who have studied actuarially what's happening here. So he added that, I thought about going without insurance, but my family suggested that I shouldn't do that. So the Affordable Care Act has created a terrible quandary for me, he said. At this point, I feel as if the federal government is like a mean big brother making my life miserable. William from Granger, Indiana, emailed to tell me that his wife, who works as a part-time nurse, now no longer is offered health care because she is part-time. And the law specifies that if you work under a certain amount of hours, the employer does not have to provide insurance, and that's exactly what the employer has done. So William then decided, well, okay, I'll have to go into the exchange and find insurance for my wife and my family, and discovered that their premiums will rise to $19,076 a year. He goes on to say, so much for if you like your plan, if you like your doctor, your costs will go down by $2,500. Let me repeat that. The president has said, your costs are going to go down by an average of $2,500 a year. Williams' costs increase over $7,500 a year. That's a $10,000 swing. That was not what was promised. Brandy from Cambridge City, Indiana, told me I've been offered insurance through work at a cost of $318 or $80 a week. I then checked healthcare.gov, Affordable Care Act, and been given a quote of $450 a month. I work a minimum wage job and work as many hours as I can to get by as it is. After taxes and child support, which I have to pay in order to be, child support in order to work, neither option is an option that I can afford. I also can't even afford to pay the penalty payment. These are just a few of the hundreds, if not thousands, of Hoosier comments that I have heard from people who are experiencing sticker shock when they search for a so-called affordable plan under Obamacare. I don't know if these people are Republicans, are Democrats, conservatives, moderates, liberals, non-voters, voters. These are just human beings that live in my state, regardless of their political affiliation, are basically saying this thing is killing us. And all these examples, multiplied by hundreds, if not thousands, are contributing to the inequality that the president is talking about. The inescapable truth is that the Democrats forced an unwanted, unpopular, and unread, famous quote from then House Speaker Nancy Pelosi, got to pass the bill so we can find out about it, what's in it, and we're finding out about what's in it. An unwanted, unpopular, and unread 2,000-plus page, one-size-fits-all health care dictated by one party without any support, without any contribution allowed by the minority, questioning whether this is the best way to deal with health care issues. Jamming this thing through on Christmas Eve Day, 2009, it's turned out to be a disastrous Christmas gift for the American people. Families across our country are being forced to redirect money they would have used to pay rent, to help their children attend school, to put food on the table, to pay the electric bills, and finding that many can't even do that. So, as we discuss the issue of income equality, and it appears that the president is going to want to do that throughout this coming election year, let's not pretend that Obamacare is helping the situation. It's not. And we need to face up to the fact that the Affordable Care Act, boy, I'll bet the writers of this bill wish, if they could do it over again, wish they had not used the word affordable. They could have called it the Health Care Act or Health Care Act for American people or whatever. If they went back and rewrote it, I'll bet you they'd drop the word affordable based on the facts, not the perception, the facts as to what this health care bill is. And I suspect that they would have wanted to pass this in a bipartisan way so that at this particular point in time, they wouldn't have to take full responsibility for this act. Too many hardworking American families are paying more, not less, for health care because of Obamacare, and it is contributing to the inequality that the President continues to talk about. Mr. President, with that.